Hello and welcome to India Top Doctor. Today we are back with another section of the Health Dialogue, and our guest for the day is Mr. Rajeev Mehra. Dr. Rajeev Mehra is well known for his excellence in naturopathy skills. Nowadays, when the COVID has been affecting every aspect of every single life, there has been a shift observed towards Ayurveda and naturopathy. Also, there has been a special technology in the autoimmune correction. To discuss more on this, please welcome Dr. Rajeev Mehra from Mumbai. So, can you please tell us about genetic and autoimmune correction?
Yeah, see, this is basically the prime thing that one should work upon in wellness and health industry. Whatever we face in our life is all pre-programmed. When we are born, it's already there with us what we are carrying. Our 46 chromosomes carry an imprint of every disorder or the functioning of every organ or whatever the challenges that we face. So here understanding is very important as to what we are prone to. In modern science, we see that only when the disturbance is not able to be controlled or is beyond the means of the person, then they go for a treatment. And even in the test, until it is not properly damaged, the area will not be known. Whether you say diabetes or cancer or arthritis, the tests that are reveal only the damage. So we have to wait for the damage to take place for it to be assessed as a disease or a damage. Whereas in genetic mapping, what we do is, even for a 1 day old baby, a 10-year-old child, or maybe in teens, when we do a test, we are able to read the 46 chromosomes and indicate to the patient that he is a probable patient for XYZ disease. We don't have to wait till he's 40 to be told that you are diabetic. We don't have to wait till the time chemotherapy is recommended to be told that you have cancer. No. So here in the technology that we are into, it's state of the art technology, whereby years before we can diagnose and we can give an indication, an assessment report to the patient of what he is prone to. So genetic correction or genetic diagnosis and genetic correction is very much the need of the hour, so that we don't wait for the damage to take place in the body. Next is immune system. As long as the immune system is strong, it will fight all invading diseases. The microorganisms like bacteria, viral, fungal, parasite, pathogen, everything will be taken care of if our immune system is functioning normally. Unfortunately, what happens over a period of time due to our lifestyle, eating habits, junk food, no exercises, our immune system gets weaker and weaker, and a time comes when it gets into an autoimmune mode. This autoimmune mode means it is helping to get in all the things, possible things that can affect you in the negative manner. So rather than protecting you, it is doing more damage. Now, if anybody has any disease, whether it's asthma, arthritis, diabetes, cancer, heart problems, 100% they will have an autoimmune disorder. It is unfortunate that our modern science is not working on these two parameters. Thus, they will not be able to diagnose the autoimmune status. But in our case, like when a patient, even when they come to us, they don't have to tell us why they have come to us. They don't have to tell me what is the problem. I run a scan on them, and in 5 minutes, I'm able to scan for 7,000 parameters, and I'm able to give them an indication as to what they are prone to. One, by reading the 46 chromosomes. Two, by knowing the status of the immune system. So if the immune system has got into an autoimmune mode, we know which area it is going to get disturbed. So this is a far advanced science what we are into, whereby genetic and autoimmune, with the help of genetic and autoimmune corrections, we can help the patient in correcting the disease or the disorder before it can affect them in any way. Yeah.
So, how is this genetic and autoimmune correction helps in solving the inherited diseases?
When a child is born, you will find that people are saying, oh, iska naak dekho maak pe gaya hai, iski aankheं dekho daddy pe gaye hain. So basically, it's an imprint of both the parents. The child is an imprint. The child carries all the good and the negative qualities of both the parents. So basically, we know only one thing in allopath, they call diabetes as hereditary. Okay. And you will find that the children of the parents having diabetes are also diabetic. But then, if you see on the broader spectrum, you will find that ladies who have thyroid issue, their daughters will also have it. Ladies who have PCOD problem, uterus problem, their children will also have it, daughters will also have it. So basically, every disease is inherited. It's only to the level of disturbance that one can find. One. Two, are we working on it to keep it under control, or we are not able to look into it? When I say keep it under control, if our lifestyle is good, eating habits are good, exercises are there, we can delay the process. It's already there. Inherited diseases, even cancer is inherited, arthritis is inherited, asthma is inherited. All diseases are inherited. The only thing is, how soon will they affect your kin? How soon they will disturb your children? Okay, so we recommend that when your child is in his teens, get a test done so that we can find out what he is prone to, or fall in love, get married, don't produce any children. Before you opt for a child, have a test done, father and mother, and we will be able to tell you who is prone to what disorder. If it is corrected, if the genes are corrected, if the chromosomes are corrected at that point of time, and then they go for a baby, and then they plan a baby, the baby will not be carrying the same format. So this is possible that all inherited diseases can be reversed, can be stopped if proper correction is done at the right time. Okay.
Okay, so recently we have been seeing that the immunity system of people, of large number of people, have been affected badly. So does this technology helps it regain
Yeah. See, like I said, that this is a computer diagnosis where we scan 7,000 parameters in the range of 0 to 100% scanning. Here we find out where what you are prone to, what is working low and what is working out of proportion. Correct? So if we are able to gauge where the problem could start, where the problem could come up, and the corrective frequencies are given, we can stop or we can correct the immune system of the general public. The reason being, today the lifestyle has changed. Today I'm a senior citizen, but when I was a kid, maybe, okay, Coke we had, but we didn't have McDonald's. We didn't have Kentucky Fried Chicken. Maybe at our times, fried food was very less. We wouldn't go out and eat. But today, if you see our children, they live on fast food. They live on pizzas and pastas. They live on all the possible junk food that they want. They want Cokes and Pepsis. So things have changed. Basically, what we have done is we are disturbing our immune system beyond repair. So once the immune system is getting weaker and weaker, the age of the diseases to set in is getting smaller and smaller. So earlier, where people at the age of 40 would get diabetic, today you will find that the same range has come down to 30. It's come down to teenage. Why? Because of the lifestyle. We sleep till 11 and 12 in the afternoon. We watch TV and are on the mobile the whole day. At our times, we didn't have any mobile. Correct? So even use of devices, electronic devices, are causing a loss in our immune system. We are disturbing our immune system by all these things. So if a check is kept on these things, we can definitely repair and make our immune system stronger. Okay.
Sir, thank you, sir. Now, we won't take much of your time. Just one last question I have. Is it possible to get genetically immune from the COVID variants?
Yeah, definitely. Right from the start of COVID, we have been diagnosing the patients in every uh, level whenever COVID, the variants came in, and we were able to find out that some of them had the black fungus, some of them were affected with the white fungus, and maybe dengue and other reasons. So here what happens is, once we find out that what is it that's disturbing you, what is it that is disturbing your immune system, by working on it and by seeing to it that we disarm those areas that are instigating the infection in the body, instigating the problem, which is COVID or Omicron or whatever variant you call it. If these areas are corrected, the chance of one suffering from Omicron or any of the variant or COVID will be negligible. It's only because of our immune system. Our immune system is weak. We are not able to fight it out. And that is the reason why we are subjected to it. We are getting disturbed with it. But if proper treatment is given in balancing your immune system, definitely we have been able to help a lot of people to get out of uh, Omicron and COVID. In fact, I'm happy to say that there were few people who were in ICU because of COVID. And with the help of the treatment, what we do out here, that is genetic and autoimmune repair, in 3 days' time, we were able to get them out from the ICUs. So, yes, it is very much helpful, and it's a boon to us today. If everybody looks into the new way of life, the new way of health and wellness, that is, don't wait for the disease to strike you first. Work, try to find out what you are susceptible to, get the corrections done, And definitely, you can stay away from any disease, any disorder, or even COVID. Okay.
Thank you so much, Doctor, for giving us so much information. We'll be joining you in the next interview on some other topic. And if you want to book an appointment with Dr. Rajeev Mehra, you can book your appointment by visiting India Top Doctor's website. Thank you for watching us. We'll be back next time with our new guest. Till then, stay connected with India Top Doctor for more such videos.